My name's Joanna, and today I'm going to be performing an oral facial exam on a little girl called Emmy, who's 7. The purpose of this exam is to determine whether there is a functional or structural basis to the speech sound disorder. And for the exam, I'm going to be using some tools. So I have some hand sanitizer and some gloves, first of all, to keep everyone safe and make sure everything's clean. I have some tongue depressors, a straw, a mirror, a flashlight, and a timer. Okay, so now we've seen the tools, we're ready to welcome in Emmy. So I have sanitized my hands and put on some gloves, and thank you for coming in today. Who do we have here today? What's your name?
Emmy.
Emmy. Hi Emmy, I'm Joanna, and I'm going to be performing an oral facial examination on you today. So nothing's going to hurt, just got a few tools here that I'm going to use to help me look at your face and in your mouth. All right, so before we get started, are you nice and comfy?
Yeah.
Great, can you open your mouth for me? Wonderful, I've got a great view inside there, so that's great. Okay, you can close your mouth, just relax, perfect. All right, so first of all, you're comfy, I've seen inside your mouth, and I'm just going to look at the facial structures to begin with and any facial symmetry or asymmetry, and I'm seeing that everything is lovely and symmetrical right now. Your lips are lovely and symmetrical, and I see that your lips are closed at rest, which is a great sign of nose breathing, so no mouth breathing, and that's what we want to see. We have no congestion or velopharyngeal insufficiencies there, and with this lovely symmetry, that would indicate that we don't have any neurological problems. So, great job. All right, great job, Emmy. So this time, I'm just gonna have a little look at your jaw, okay? So what I'd like you to do is just move your jaw from me, from left to right or side to side. Just slowly. Great, I'm not seeing any dissociation there between the jaw and the lip, so that's all looking great. All right, this time I want you to open your jaw. So can you go ahead and open your jaw? Perfect. And now close. And open. And close. Okay, I'm seeing a lovely range of motion there. This time I'm going to have you open your jaw again, and I'm going to feel for any popping, grinding, or TMJ noises, okay? So just slowly go ahead and open your jaw. And close. And open. And close. And all feels great and smooth there. I'm not hearing anything to be concerned about. All right, one last time, you're gonna open your jaw again, but this time I want you to copy my hand. So you're just gonna open super slowly, and then we're gonna close super slowly again. All right, ready? So, wide. Good job, and now slowly close. All right, let's try again. Open slowly for me. Fabulous, and then close slowly. Super, good job. We've got some nice gradation there. Well done. Thanks, Emmy. So the next thing we're going to do is take a little look at your teeth, all right? And for that, I'm going to be using a tongue depressor, which you may have seen before. It looks a little bit like a popsicle stick. Unfortunately, it's not quite as exciting because there's no popsicle on the end of it, all right? But it's the same idea. So first of all, I'm just going to put this in your mouth just so I can have a little look at your teeth, all right? And it's going to help me move your cheek. So if you could open your mouth for me. Good job. And then if you could turn that way slightly for me. That's great. And then I'll do the same on the other side. If you could look that way for me. Perfect. Okay, so I'm seeing Emmy has all of her molars and they're all aligned. Go ahead, open your mouth and then gently close for me. Open. Okay, I'm not seeing any crossbite or any overbite there. She seems to have all her teeth right now. Open again for me. I do see it looks like the lower central incisors have erupted, but they've all grown back lovely. They're a good shape and size, and there's a good alignment there in the dental arch. Great job, Emmy. All right, you're doing great so far, Emmy. Thank you for all of your cooperation. The next thing I'm going to do is look at your lips, okay? So first thing you need to do is give me a pucker. So pucker your lips and say, ooh. So nice rounding of the lips there I'm seeing. Perfect. Okay, good job. Okay, now I want you to big smile and say, ee. Wonderful. I'm seeing great symmetrical movement there and no drooping of the lips, so that's great. This time I'd like you to put the two sounds together. Okay, so ooh, ee.
Ooh, ee.
Good job, and one more time.
Ooh, ee.
Perfect. Okay, I'm not seeing any scar tissue or any weakness in the lips there. I'm seeing some good sensation and good strength. All right, wonderful. Next thing I'm going to have you do is puff your cheeks out for me and then hold the air in, okay? Just like that, that's perfect. So, okay. Now relax. Okay, and do that one more time for me. Awesome. I don't feel any air escaping from the lips there, so that's great. Good job. Thank you, Emmy. Okay, the next thing I want to do is look for any nasal emissions, okay? And for that, I'm going to use my little mirror here. I want to check that there's no air escaping through that velopharyngeal port. So I'm going to put this under your nose and you're going to puff out your cheeks and hold the air in for me, all right? Like this. Good job. And that's great. I'm not seeing any fogging on that mirror. It's nice and clear, so no nasal emissions to be concerned about. Great job. All right, the next thing I want to do is take a nice look at your tongue. I'm looking for three things. I'm looking at the appearance of your tongue, the size of your tongue, and the strength of your tongue. So go ahead and show me your tongue. Stick it out for me. Lovely. I'm seeing it's a lovely pink colour. I'm seeing the size is good, not too big or too small, and I'm not seeing any jerky or uncontrolled movements. No fasciculations. It's all nice and calm in there. All right, next thing I want to check out is your frenulum. All right, so if you could open your mouth, I'm going to look at the piece of tissue under your tongue to the floor of your mouth, and it helps you when you eat and swallow and speak. If you open your mouth a little bit wider and then put your tongue up, can you put your tongue up to touch the dad's? Perfect. Okay, get the frenulum's there and it's a great size, not too big or too small, so that's looking great too. Now I'm just going to test the strength of your tongue. So if you could stick your tongue out to touch the tongue depressor here, and I'm going to push against your tongue. Try not to let me win. Okay, you want to keep your tongue out. I'm going to try push it in. Okay, open your mouth, but try not to rest on your lips. That's it. Perfect. Okay, and I'm going to push. Ready? Feel the pressure. Excellent. Yeah, nice strong tongue there. We're going to do the same on the right and the left. Okay, so your left first. So this side. Go ahead and stick your tongue out sideways, push. Excellent strength there. And then the other side. Awesome, great job. I'm going to make a note of that strong tongue. Now we're going to listen to the sounds of your tongue and look at the tongue movements, okay? So first of all, I'm going to hear you go, ah.
Ah.
Lovely, ka.
Ka.
Good job. What about laka, laka?
Laka, laka.
Nice. I see nice anterior and posterior movement of the tongue there. I see obviously retracts and protrudes nicely. Now I'm going to have you stick your tongue in and out for me. Perfect. Now up and down. And now rapid tongue movement side to side. Good job. Thank you. So now I'm going to use my flashlight and my tongue depressor to have a look at your oropharynx, okay? So I'm going to use this. I'm going to turn this on. And I want to hear a nice ah.
Ah.
Lovely. Thank you. You can relax. Okay, it's a lovely colour in there. I see your tonsils were in there. They all look good. I'm now going to have a little look at your alveolar ridge, so above your mouth. I'm going to check the height and width of your palate as well. Okay, lovely. And I see a great height and width there. I see a lovely arch. It's not too flat. And I see no growths or fistulas. Nice and normal in there. Okay, so gag reflex next. I'm going to take my tongue depressor. Don't worry, I'm not going to be mean. I'm not going to go too far into your mouth, but I am going to place it into about the midway of your tongue, okay? So if you could open your mouth for me nice and wide. Put your tongue down for me. Just relax your tongue. Okay, perfect. Okay, great. Nice gag reflex there. All looking normal in there. That's wonderful. Next thing I'm going to check is the soft palate, so your velum. I'm going to use my light for that. I'm going to have you say, ah.
Ah.
Wonderful, thank you. I see a nice symmetrical movement of your velum. It's moving up nicely. And I see a good closing of the velopharyngeal port there. Okay. Lastly, I'm going to check the uvula, which is a bit of tissue that hangs down in the back of your throat. Have you seen that before? You don't notice that before? Okay. Well, next time you look in the mirror and open your mouth, have a little look for it. It's called the uvula. Open wide and say ah.
Ah.
Great job, thank you. I see it's hanging nice and centrally there. There are no deviations to the left or right. So nice and normal. Thank you. You're doing a great job so far, Emmy. We're nearly done, okay? The next thing I want to do is take a little look at your nasal cavity by listening to some, you said giving me some words, some sounds, okay? Well, actually, I've got words behind me. Can you read those words behind me? Okay, great. Because I know you're only 7, so I wasn't sure if they'd be too challenging. Oh, you're reading Harry Potter, you'll be fine with my words then, okay? Do you see some green words on the board behind me? Great, those words are nasal words. So I'm going to feel the side of your nose whilst you read them to make sure I can feel the appropriate vibrations, all right? So when you're ready, if you could read the green words, and it doesn't matter if you make any mistakes. Okay, go ahead.
Bunny, mummy, funny moon, candy nose, nap.
Excellent. I'm feeling appropriate hyponasality there. There is some good resonating in the nasal cavity, as there should be, because they're nasal words. So I will make a note of that. Excellent job, Emmy. Thank you very much. Okay, now onto the hypernasality. And for that, I'm going to use a little straw. I'm not going to go high up your nose with it, don't worry. I'm just going to put it in really gently, and then I'm going to have you read the pink words here, which are the oral words. All right, and I'm just going to listen to the end of the straw for those vibrations. Okay? All right, when you're ready, go ahead.
Bunny cupcake, happy carrot, purple hop bubbles.
Wonderful. Yep, that was great. I'm not hearing any vibrations through the straw, so we have appropriate hypernasality there as well. Thank you, Emmy. You're doing so great. This is the last thing I'm going to ask of you, I promise. So thank you so much again. Okay, right now I am going to do a little speech rate test. And this is important because I'm going to be able to see how the structural and physiological components of the speech mechanism are working. Okay, so before we start, you're going to have to take a deep breath. And you're going to say, pa, 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 as fast as you can, okay? Until I stop you. And if you want to look at this, just to give you something to focus on, you can. But you're only going to do it for about 10 seconds, just as many times as you can. Okay, so deep breath. Go. Excellent, perfect. Good job. Wonderful, well done. Okay. We're going to do that again now, but this time we're going to change our word or our sound, okay? Instead of saying pa, 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 I want you to say ta, 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 ta. Can you say ta, ta for me?
Ta, 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 ta.
Right, so as many times as you can, okay? When I say go.
Ta, 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 ta.
Awesome, you can stop, thank you. Good job. Okay, we're going to do it again. This time we're changing it, switching it up again, and you're going to say ka, 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 ka. Good job, just like that, perfect. Okay, are you ready? Go. Super, well done. Okay, now we're going to put some sounds together, all right? I'm going to change this now to about 6 seconds, and I want to hear you say pata, pata, pata. Can you try that?
Pata, pata, pata.
Okay, good. Let me turn that off there. It's still beeping. Okay, never mind. It's still beeping. It'll work. Okay, ready? And
Pata, 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 pata.
great job. So this time you're going to do the same again, but 3 sounds. Pa, ta, ka. Can you practice?
Patika, patika, patika.
Just like that, all right? As soon as I flip my timer here and hit play, you're going to do that for 6 seconds, all right?
Patka, 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 patka.
Great job. Thank you so much. Awesome. Emmy, you have been a little star today. Thank you so much for coming in. I've got lots of lovely information. You did great.